As a spine surgeon, I've given thousands of injections, and whether you're giving a TB skin test or injecting a joint with a steroid, there are some ways to do it to ensure that it's as pain-free as possible for your patient. The first is understanding anatomy. The skin is particularly rich in free nerve endings, meaning that it experiences pain much more sensitively than the deeper layers such as the subcuticular fat and or muscle. So getting through that skin layer as quickly as possible and as straight as possible will actually help relieve the pain of the injection. I think of it as a quick jab rather than a slow push. And once you get the needle in there, make sure you keep it on the same trajectory instead of moving it around. As you move it around, that'll obviously irritate the skin and free nerve endings, making it much more painful. The second tip is using as smallest gauge needle as possible. Obviously, the larger the gauge of needle, the more painful it will be going through the skin. And so use the smallest gauge possible that's appropriate for the injection that you're giving. The next tip is anesthetize the skin somehow. I like to use ethyl chloride or freezy spray to do that, but there are a lot of ways that you can accomplish this. And finally, if you have to use a large needle to give an injection, such as a spinal 18 gauge needle, numb the skin up first. That way they won't feel the large needle going through. And follow me for more.